Assalamu alaikum. Today I'll be presenting a clinical study titled with Biomechanical Characterization of Immature Root Following Regenerative Endodontic Treatment and MTA Apexification, done by Iranian group of Ali Nosrat and colleague at 2025 and published at JOE. This paper is the first clinical study that assists the biomechanical properties of immature root after regeneration and MTA apexification. Since the regeneration has been provided in many clinical study with increased root length and thickness, however, the quality of these newly formed tissue remain unclear. Therefore, the aim of this study was to determine the clinical and radiographical root volume of immature root following regeneration and MTA apexification, and also to assess and compare the hardness and the modulus of elasticity of both treatment procedures. It is experimental clinical study used a match pair design with 6 patients aged between 9 and 14 years old. Each patient had 2 immature premolars scheduled for extraction and planned for extraction for at least after 6 months, and one tooth was randomly assigned to regeneration and the other received MTA apexification. After performing pulpectomy, the regeneration was done using the blood clot scaffold, followed by placing of the collagen barrier and MTA, and in the MTA group the canal was completely obturated with MTA. And after 6.5 months, all the teeth were extracted and analyzed. A micro CT was used to evaluate the root volume in all 3 dimensions, and nanoindentation was used to measure the hardness and the elastic modulus of the treated roots. The result demonstrated first with regarding to the root volume. The regeneration showed significantly higher root volume compared to the MTA group, confirmed that regeneration promote continuity of the root length and thickness, with the mean root volume in the regeneration with around 223 cubic millimeter and 200 cubic millimeter in the MTA group. However, in terms of hardness and the elastic modulus, the MTA showed significantly higher value across all the region, with MTA group the hardness range from 0.56 to 1 gigapascal, while regeneration is 0.32 to 0.65 gigapascal. And in the elastic modulus, the MTA range from 10.5 to 22 gigapascal, while regeneration is only 5 to 12 gigapascal. Another observation was noted is the pattern of changes within the root structure, with both hardness and elastic modulus increased from the outer dentin and toward the canal lumen in both group. This study highlight to that with increased root volume in the regeneration, the quality of these newly formed tissue are significantly lower than the MTA group. Although this study is the first clinical human study evaluate the biomechanical properties of immature root after regeneration and MTA, with a good design of match pair design, which reduce the inter-individual variability. However, it contains some limitation, including with very small sample size with only 6 patients, with a follow-up period of around 6.5 months, which may be not sufficient for a full maturation of the newly formed tissue. And also, this study include the teeth with vital tissue structure, which is non-infected, which may not fully replicate the real clinical scenario of regeneration procedures. However, from the clinical perspective, this study presents with good dilemma, where the regeneration offer increased root development but it produces with lower mechanical properties, while MTA, on the other hand, produce with good mechanical properties with stronger dentin, but does not allow for the further root development. Therefore, the clinical decision become uh, judged to be balanced between the quantity and the quality of dentine structure. Thank you.